Morning to you, 7 past 7. So the border closure with the Prime Minister in about half an hour, along with another number of other matters. But health matters, first of all. The Health Minister, David Clark's with us. Good morning.
Morning, Mike.
Can you give us the numbers? When we say 28 cases, by the way, what I'm concerned about is we don't say how many are through the other side. How many are through the other side?
Look, I actually don't have that detail in front of me, but a number are. I know that people have completed the self-isolation period. Those who were in hospital, I think there's, now this is really testing my memory, I think 3 that have been through hospital and come out the other side, and 1 that's expected to need hospital-level care at this stage.
Because this is a multi-week event, and those early cases, 1, 2, 3, 4 and 5, they must be out the other side or close to it, which means
Indeed.
The actual active numbers dropping.
That's exactly right, Mike. Exactly right.
Okay. Can you tell me, and we've tried this week to absolutely no avail whatsoever from the ministry, how many test kits are in this country right now?
I can't tell you that exact number. It's a number that I have myself been trying to get my hands on because there are different components to the test kits. There's the swabs. I understand we've got 30,000 of them in the country and 90,000 roughly on order and due soon. There is the chemicals, there's the physical parts of it and so on. So I'm actually expecting hopefully today to get a good breakdown of that because I want to know where they are in the supply chain. I'm told we've got plenty on order, so that is of course some deal of comfort, but I also, as you'd expect, want to know that they are going to be arriving in the country imminently because we need a long,
we do.
We're going to need a long supply of this.
Shouldn't we be frightened that the Minister of Health doesn't know how many test kits we've got in the country?
Well, I think you should be comforted at least that the Minister of Health is all over this. This is the big thing for me, to make sure that we have those test kits in the country because I think it's absolutely critical that we can continue to test. It's been the thing that the World Health Organization has said we need to do alongside self-isolation and that contact tracing, and those things being done successfully is what's led us to be in a position that is much better than other countries at this stage.
How many ventilators do we have in the country at the moment?
Well, we have 233 ICU and HCU beds set up. We've got a bunch of other ventilators as well that are in mobile situations, 40-something, and so on. And so you get to a number that's close to 300 in terms of ventilators. Of course, that's another area where we are looking to see what capacity can be brought back online, particularly those that were recently retired units, as to whether they can be brought back into service very quickly. And also, on top of that, if we need more stocks. But the thing with the ventilators is actually the people to run them. That's the limiting point. So people are being trained right now and how to use them. That's what they found in Italy, where they found themselves very quickly in a difficult situation where they had the ventilator units but not the people to use them.
Just about to ask, companies are recruiting retired doctors and nurses. Does that worry you or encourage you?
It encourages me. I'm glad that that's happening. I think the important thing is that those who are retired are kept away from the immediate risk of infection. We have telehealth services which are able to scale up and are being used increasingly. And where those retired practitioners come back, they should be able to observe social distance, I think, particularly if they're elderly or vulnerable.
There are too many stories still of people not getting this. Does that worry you?
Not getting what? Not getting
the whole damn thing, and to isolate and distancing and wake up and take it seriously.
I think the events of recent days will be drawing attention to this in a way that people are going to find hard to avoid. The fact that now there is an expectation of social distance, and I've seen people's behaviour change in the last week, shifting to the elbow bump, and it often starts as a joke, but people are now realising that this is serious, and if we're going to keep our country safe, we need to look out for those around us who are vulnerable. We need to make sure we're just observing those practices of good hygiene, staying home when we're unwell and so on. We need to take this thing seriously because it's up to all of us. It's not something governments can regulate human interaction in that way. It's actually up to all of us to unite and take that social responsibility thing seriously to make sure that we are doing what we can do to help protect ourselves and those around us.